everybody. This is Dr. Vesta from Stunning Smiles Dental and Hearing Aid Clinic, Chennai, India. So I'm here to give you a few tips about a toothbrush. So most of us use a toothbrush, but we don't know how to maintain it and how to care for it and when to change and everything. So now I'm going to talk about 3 C's in your toothbrush. The first one is consult, then clean, and about changing your toothbrush. First, coming to the toothbrush. Many of us don't know what toothbrush we are using. I was surprised. Recently, I started asking my patients what toothbrush you're using, and their answer was they just gave me a brand, but they didn't tell me what specified toothbrush they are using. So I started asking my patients when they come for the second visit to bring their toothbrush along with them. I was really surprised. A 48-year-old male, he showed me a toothbrush which he is using, which was an orthodontic toothbrush. Surprisingly, you use that orthodontic brushes only on patients who wear braces. But this person was using an orthodontic toothbrush for past 3 years, and he was saying he didn't even change the brush and it was totally flared up. Then I thought I should do a video on this. That's why I'm doing this video today. Okay. First, you have to consult your dentist and know what kind of toothbrush you are supposed to use. In general, there are 35 to 40 brands of toothbrush available in Indian market. But then you need to know what would suit you better. In general, there are 2 types of toothbrushes. One is the manual toothbrush and the second one is an automatic toothbrush. In manual toothbrushes, there are 3 types, that is generally hard, medium and soft. And we do even have extra soft for sensitive patients. So in general, we only prescribe medium toothbrushes if you don't have any problem. And then we do have another toothbrush called interdental toothbrush, which goes in between the teeth and cleans, especially when you take non-veg like meat or something sits in between the teeth. You can use that brush to clean the food that is impacted. And then coming to the automatic toothbrushes. Automatic toothbrushes we don't generally prescribe, but we prescribe for people with lots of soft deposits and hard deposits and special children. Automatic toothbrushes are prescribed. And then cleaning the toothbrush. We clean our teeth, but we don't clean our toothbrushes. Surprisingly, the amount of bacteria in the toothbrush is more compared to the amount of bacteria in your mouth. So it is better that you have to clean your toothbrush in a proper way. And there is another surprising fact that you even find fecal matter in some of our toothbrushes. I mean 90% of the toothbrushes contain fecal matter. When you finish cleaning your mouth, you put the toothbrush in the toilet, and when you flush your toilet, the fecal matter sometimes splatters and it even sits on your toothbrush. It is very surprising. So it is better that you don't put your toothbrushes inside the bathroom. So you have to dry your toothbrush and don't just put it inside a cap and leave it inside the bathroom, because the bathroom is always humid. When it is humid, wet, that becomes a very good source for the bacteria and fungus to grow. So it's better you dry the toothbrush and make it a habit that you put the toothbrush outside your bathroom. Somewhere you just find a place, make a place for it and put it there in a safe place. Number 2 is, first I discussed about consulting about your toothbrush, then cleaning about your toothbrush, and the third one is changing your toothbrush. Some of us use the toothbrush until it flares off totally, say for 2 years, 3 years. It is not so. You're supposed to change your brushes within 60 to 90 days ideally. Once your brushes starts flaring and it hurts your gum, yes, it's the right time you change your toothbrush. Number 2 is when you have some flu, cold, right? Any disease. that is contaminated disease, like you have cold or flu, you're supposed to change your toothbrush and wash your toothbrush. These are the basic things which are required to maintain a toothbrush. So if you have any doubts, you can just comment down and you can feel free to contact us anytime. Thank you. Have a nice day.